I'm Callie Coombs. I work at the University of California, Irvine, where I'm an associate clinical professor. I primarily manage patients with CLL and SLL. And so the question is, what has the evolution been of BTK inhibitors in CLL? So of course, ibrutinib was our first-in-class BTK inhibitor. It completely revolutionized the field of CLL. I think it really saved so many lives of people that had no options. We've seen it move from the relapse setting to the front line, but with time, of course, what we've noticed is that there can be a lot of adverse reactions related to ibrutinib. And so thankfully, we've seen the advent of our second generation drugs that have improved selectivity for the target BTK with less off-target effects that have translated then into improved safety profiles. And so these two agents are acalabrutinib, which was deemed non-inferior to ibrutinib in the ELEVATE-RR study, but with significantly improved safety with less AFib, less hypertension. But also zanubrutinib, which in the Alpine study showed superior efficacy to ibrutinib and with also improved safety, especially with respect to its cardiovascular AEs, also low rates of AFib. So in my own practice, I'm pretty much never using ibrutinib for my new starts. I almost always will go to one of the second generation drugs. Obviously, it's a big topic. Oh, which one between acala and zanu? I think we're really splitting hairs when we say, oh, is one better? I don't really put a lot of weight into these match adjusted and direct comparisons. I think they're somewhat artificial studies. The fact is we're not going to have a head-to-head, but I think the other fact is that these are just great drugs. And I think it's so much easier to put a patient on a BTK inhibitor and be able to have them stay on it with a great quality of life, with minimal side effects, and with excellent disease control. So I think they're both really good drugs. I'd say that ultimately, either one I'd be comfortable with my patients on. Sometimes our choices are dictated by a patient's drug coverage plan. It's not always our choice, unfortunately, in medicine, but I think they're both great options.